I have experienced people in my family struggle from this arthritis disease. This is one of the hardest diseases to come across. Life is filled with life-changing experiences, and the ones that push through them are the ones that make them as easier as others. Today I will be informing you about rheumatoid arthritis, osteoarthritis, the symptoms, and how it is diagnosed. First and foremost, what is arthritis? According to enzoboom.com, RA comes from certain genes that play a role in the immune system for people whose genetic factors may be involved in determining whether they will be developed in RA. RA can be triggered by infection in people who have inherited a genetic tendency for the disease. It's important to remember, however, RA is not contagious. RA is an autoimmune disease in which the body immune system attacks joints tissue, causing inflammation of the joint lining. However, as there are other forms of RA, I will be covering osteoarthritis, often called wear and tear. Osteoarthritis, or OA, is the most common form of this disease. In OA, joint cartilage breaks down over time, causing symptoms like joint pain and stiffness. Many ways to get OA, according to arthritis.com. Age is the most strongest risk factor in OA possible. However, due to OA, you can start it at a young age due to injury. Gender affects both men and women. However, before the age of 45, OA is more frequently in men. After the age of 45, OA is more commonly in women. Joint injury. Traumatic injury increases your risk of developing OA, and the joint plus joints that are being used repeatedly may be more likely to develop OA. Obesity is another factor that can make you catch OA. Generally increasing the amount of weight that the body joints have to bear. The knee is commonly affected because it's the major weight-bearing joint. People with joint deformities like bow leg, unequal legs, or knocked knees are more likely to develop OA in these joints. An inherited developed defect in one of the ones responsible for creating cartilage may be a factor in developing OA. Cartilage is important because it acts as a shock absorber, allowing the joints to move smoothly. As cartilage breaks down, the joint may lose its normal shape, and eventually the ends of the bones may begin to rub together, causing pain, swelling, and loss of motion in the joint. Next, I'll be covering the symptoms of RA. Painful, swelling, warm joints, painful stiffness when sleeping for more than 30 minutes in the morning or after a long rest, inflammation in the neck, hands, feet, shoulders, ankles, and knees. Symmetrical patterns of inflammation, fatigue, fever, and generally feeling discomfort. Finally, I will cover how RA is diagnosed. According to Humira.com, arthritis is something that we all have a high risk of getting at one point or another. So it's best to always know if you have this disease, to get checked up by the doctor. A rheumatoid factor test looks for antibody called a rheumatoid factor. About 80% of people with RA will eventually have an antibody, although it's possible to have rheumatoid factors in your blood. Although tests measures your erythrocyte sedimentation rate, people with RA tend to have abnormal high sedimentation rates. X-rays are used to help determine the extent of the damage in the joint that are affected by RA. Plus, a sequence of X-rays take over time can help show the progress of the disease. Your doctor may perform joint aspirations. In the procedure, your doctor uses a needle that draws fluid from a joint and examines it. There are all facts. These are all facts that I have gathered from researching and asked questions to my mother and grandmother. has RA, my mother has RA, and my grandmother has OA. In conclusion, OA and RA is a serious disease that everyone can catch. Over 80% of Americans above the age of 65 or older have this disease. This disease is not something to play about. You must always try and get checked up as soon as you can. Today, I have informed you about osteoarthritis, rheumatoid arthritis, the symptoms, and how they are diagnosed. Life is filled with life-changing experiences. The ones who push through them are the ones who make it not as bad as others. Arthritis is a very powerful disease. It is important to know if you have it. Please check yourself if you have the disease.